Good morning. I'm Dr. Jennifer Sullivan. I'm the Secretary of the Indiana Family and Social Services Administration, which is Indiana's Health and Human Services Integrated Agency. I'm so excited to be with you virtually this morning. We're going to talk about a story today and how the use of a data-driven approach to human services transcends pandemics and economic uncertainty and the human condition, and really puts us in a place where we can make a difference in people's lives. It seems like that sort of touchy-feely intersection with numbers and dashboards and databases may not make a whole lot of sense, but I think one of the themes, overarching themes of our conversations that will happen today is that's actually just exactly what we need to move forward in improving the overall health of the citizens of the United States. So I'm going to walk you through a little bit of a story, and one of the phrases we use here at FSSA is that data matters and stories convince. Today we'll talk about a few things. I'd like to describe to you a model for data infrastructure for social drivers of health. This is not something that we usually think about. It's a very personal experience to know what are the unmet social needs for individuals. But we decided in Indiana that we'd build a data infrastructure to really understand people a little bit better than we used to. We'll also explore the impact of human services data support for Indiana's COVID response, and then propose expansion of connectivity between public health, human services, and healthcare for enhanced prediction, prevention, and mitigation of health crises. So as I said before, in Indiana, we say data matters and stories convince. So I'd like to tell you the story of how social drivers of health brought our Human Services Agency together so that we had a pandemic playbook ready to support our COVID response, even though we didn't know when we built it in 2018 that this would happen. We began our journey to understand and integrate social drivers of health into our agency in 2018 because we just couldn't seem to budge our health outcomes in the state of Indiana. They were stubbornly stuck at 41st in the nation. Well, so we didn't have anywhere to go but up at this point, and we needed to do something a little bit different. And we knew that if we kept just doing the same thing in human services and healthcare delivery, we would keep finding ourselves in the same spot. So we launched the Office of Healthy Opportunities to create a unifying platform for understanding health globally and how every one of our programs under the umbrella of FSSA was connected to individual and community health. Our strategic plan to health equity is elegant in its simplicity. It's so easy to start with building programs, and in fact, we're tempted to do that. When we see a problem, we build a program to address that problem. We decided to do things a little bit differently because we realized that we had to understand our members, our citizens, better before we would be able to know the who, what, where, and why of policy and program development. And so I'm just going to spend a few minutes on the understand part where we began and talk about how they become the drivers for priorities by highlighting disparities and needs beyond standard data collection and integration. So our data warehouse here at FSSA includes Medicaid data, SNAP data, TANF data, mental health data, childcare data, and it's not enough. It's just a snapshot, a little snapshot of people and communities. We needed to know what our members' perceived needs were in an innovative way. So we did something different. We needed more. And so we added the 10 health leads questions to the end of every SNAP, TANF, and Medicaid application. We get about 120,000 of those online every single month. And so this is a very rich source of information directly from people about what their needs are that they're experiencing every day. We celebrated our 2-year anniversary just a couple of months ago of this being live. And we have nearly 500,000 data points for these responses. And nearly 1 in 5 individuals completed the entire assessment. And here is what we did with it. We built the Indiana Health and Wellbeing Atlas, which is now a publicly available data set that can be used to see what, the who, what, where, and why unmet social needs are happening across the state. It gives us a social unmet needs dashboard or heat map and gives us the picture of demographics by place and allows us to connect with communities for planning and prioritization. This is the understand component of our cycle of strategy. And so what we do with this information is allows us to have a common data set in order to tell the story a little bit better about how our human services need to shore up a little bit in order to meet unmet needs. I hear stories every day about the things that people don't have that we need to connect them to. And a singular story is incredibly powerful. And when all of those stories come together in a collection to build out something that we can share with local leaders, share with local philanthropy, it allows us to be stronger and move faster when we talk about things together. Again, data matters, stories convince. We then move on to our path with this great data tool that we can use, and we need to do some education about what this means. So we assume that everyone understands social determinants of health, social drivers of health, unmet social needs, and all of those definitions the same, and they don't. And that is actually true in our internal team as well. And with education comes more empathy about how we do something about what we find. So we've spent the last year conducting site visits, focus groups, and an all-employee survey across our statewide agency of nearly 8,000 folks to better understand the people that work for us in human services, understand their awareness and knowledge of social context and their ability to help. And here's what we learned. Our employees had some awareness and really had a connection to the fact that human services, when delivered correctly, can improve the health of Hoosiers. That's pretty exciting. That means that we've connected to purpose in a way that our data, our spreadsheets, if you're writing a check or helping an individual sitting across the desk right in front of you, you know that you are working on and driving their health forward. Unfortunately, our team members still believe that healthcare is the greatest impact to one's health. We know that that's not true. We know that healthcare is only 20% of the driver to overall health impact. And the remaining 80% are these other unmet social needs that really will get us where we need to go. And so we understand that we have to develop this awareness in our team before we can deploy it across the state. And so we did this with an employee engagement campaign called Health is More Than You Realize. And the data that we have from our Health and Wellbeing Atlas not only informs external communications, it informs internal communications as well. I won't walk you through that entire campaign, but it is absolutely extraordinary. But I did want to share with you what it looks like in a symbol that we built. And this is our symbol. And it has some specific meaning that we have shared across the entire network, in that when we talk about health is more than you realize, here's what we mean. It is food. It is safety. It is housing. It is stigmas, employment, belonging, bias, childcare, transportation, education. And all of these things, when they work together, make an incredible difference in the life of people all around us. And some people have said on this symbol that it looks like different things to them. One of the my favorite pieces of feedback from a team member is that it looks like a heart with a listening ear. And I think that's exactly what we're talking about, is that we have a heart for the service that we need to provide, and then with it is the listening ear for the stories and the data that keep us moving so that we can address each of these unmet needs and factors that can really drive us toward improved health outcomes. So the next piece of our strategic plan is that we needed to build a network. Now that we have a data set, we have education that has led to empathy, that we need to build a network on how we actually get people connected to the things that they need. And not only did we do that, but we actually got inadvertently an extra data set to help solidify the things that we were doing and make sure that in real time we could move in the right direction. And so let me tell you a little bit about 211. So 211 is available in every state. The FCC estimates that about 98% of Americans have access to a 211 network, and it generally is a locally driven philanthropy partnership that connect people with unmet needs, whether that be housing assistance or energy assistance or sometimes functioning as a domestic violence hotline. All of these things that if someone needs something, they can call 211, and there's a repository, a database in Indiana of over 40,000 different resources that are geographically coded and can be connected in real time. We, through a partnership with the governor's office and our General Assembly, made 211 in July 1st, just a couple of months ago, part of Health and Human Services. And so they became the 8th division of FSSA, because we knew that in order to do, again, this internal work, we needed an extra layer of connectivity with the community. And so this free call center with a statewide database is now our ability to reach out and understand those unmet needs and then actually fill them. And it gives us another look into field trends that help us make informed decisions in real time. This is where the pandemic hits. So our statewide response to COVID began at the beginning of March. 211 was not yet part of our agency, but essentially became a little sister very early on in the partnership so that we could see what was happening in the field, make policy, funding, and program decisions based on the data that we were getting, not only from our health atlas, which had a huge spike in SNAP applications, TANF applications, and Medicaid applications, so we could see what people's unmet needs were, but then we could also get a dashboard in real time on what was happening in our phone calls on a daily, hourly, weekly basis. This gave us, just for example, a couple of really early indications that our mental health network was going to need to be shored up rapidly. And with that, we built the Be Well Indiana website and 211 Be Well Indiana helpline, a crisis line for individuals who needed mental health and substance use disorder supports in a way that they hadn't been able to get them before. Increases in call volume to 211 that we saw on our data dashboard about housing insecurity allowed us to make the pitch that we needed to extend our eviction moratorium for a little bit longer, because those call volumes were not going down, and we knew that by not extending that we were going to be putting people at risk for evictions and housing insecurity, which is a huge area that we really focus on here at FSSA. And so as we harness this information in a different way than we have before, again, we have information exchanges for traditional health needs. We have surveillance databases in our health department. We have Medicaid claims data that we can look at. We have childcare information. But now we have these two additional layers of more real-time data management that happen at the individual level. And as we harness this data and stories, we can then build capacity. And not just capacity for the future, capacity for today, more rapidly in real time. And this helps us build some incredible infrastructure here for Indiana's COVID response that will be part of our future of the landscape of health care and human services delivery for the future as well. Just a couple of examples. First, and I think probably one of the biggest wins, not just for us, but for the nation in healthcare delivery, is telehealth. We essentially flipped the switch for telehealth for everything, and within a week, our provider network adapted. Not just physical health, but behavioral health, mental health, substance use disorder treatments, occupational therapy, physical therapy, even early intervention in our First Steps program, where our team members say that parents and caregivers went from couching to coaching because we learned how to use telehealth to improve health outcomes while kids were at home. This is the landscape, this is the menu of healthcare delivery that we have for the future. It requires us to do some additional building in broadband and device access and platforms to get the job done. But we're going to get there, and I think it will be extraordinary to really meet people's health needs where they are, not where we are. Now, I can say that as a physician, that coming into the hallowed halls of the ivory tower of medicine is not always the best for people's healthcare. And we hear stories about that every day and how telehealth can help us overcome those barriers, reduce inequities, and really transform the way that we do our work. We also had to change the way that we fund childcare and make sure that we kept the lights on and the doors open so that individuals who were essential workers at the beginning during our shutdown had a place for their kids to safely go that they could trust. And so building out that process has been pretty extraordinary. We also built out a virtual care at home model for Medicaid, so individuals who were not quite sick enough to be in the hospital could go home with some monitoring and have a funding stream for that. And again, the technology around building that out has been really extraordinary. We also worked on Operation Food. One of the things that I found to be really intriguing in our health atlas is that across the entire state, regardless of the type of application, whether it's SNAP for food assistance, TANF for cash assistance, or Medicaid for health coverage, the number one unmet social need for the state of Indiana is food. That was pre-pandemic, and post-pandemic, it didn't get better, and you're not shocked by that in any way. Operation Food, with the information that we had from our health atlas and from our calls for 211, allowed us to mobilize for food security in a way that we have never done before. We operationalized SNAP delivery, which allows recipients of SNAP to do online ordering of their food and have that delivered to their door to keep them safe. We mobilized the National Guard to staff our food banks and food pantries to make sure that no household would go hungry. We also were able to deploy pandemic EBT to the tune of $188 million of food to children across the state of Indiana. Again, because we have information around social drivers of health, not just pandemic-based, but for the future of how we do this work, it helps us to prioritize the who, the what, and the where. We do this because we believe in evidence, and we believe that data drives planning and policy for pandemic work and for everyday life. And because of this, we are really lucky to participate in something called the State Academic Partnership. Our State Academic Partnership began in partnership with the Clinical and Translational Sciences Institute, or CTSI, back in December of 2019. And what it allows us to do is have an evaluation to everything that we do at FSSA. Not just for Medicaid policy, which is the traditional state academic partnership, but for childcare policy, for food policy, for disability work. And so that as we make changes, we can see the impact of those with an independent and smart researcher from one of our many networked institutes for higher education across the state. Because we had this in place pre-pandemic, we were able to turn on what we called affectionately the COVID-19 Daily Digest. And this allowed us to make evidence-based, data-driven decisions for every policy that we were contemplating for our statewide COVID response. And it becomes the translational science equivalent of medicine for human services. And what that integration, again, allows us to do is take our stories and our data, and we build the science of human services delivery in a way that we've never been able to do before. So what does this mean for the future? I like to call this the highway to health, in that if we can build a 3-lane highway of public health surveillance data, healthcare data about the health outcomes and clinical information for the people that we serve, and then also this 3rd lane that's, I think, really been forgotten and overlooked in how we build this highway to health in the past, the richness of human services data, and have them all pointing in the same direction with improved health outcomes as our true north goal, we can do some pretty extraordinary things. Think about if we integrate health information exchange data with public health surveillance in Essence, and human services and the Medicaid data warehouse, and Dharma data for mental health, and then take this health atlas at the individual and community level and understand people and their needs. Look at call center data for 211 and see what the human condition looks like today. That makes the world look a little bit more possible when we think about building the policies and programs to address all of those. In order to do this, we have to have integration. In Indiana, we have made some extraordinary progress in this place. We have a little known gem known as the Management Performance Hub. And it literally is a group of folks and equipment in the basement of our state house. I call it the data bunker. And the Management Performance Hub allows all of our state databases to talk to each other. So not only do we get to bring health data and human services data together, but also state police data and transportation data. And we get to think about things about people rather than programs or policies, that holistic view of what the world looks like so that we can move forward. With that, we've had to get a little bit smarter. And so we have brought in chief data officers and an entire data and analytics team to really harvest the richness and understand it so that we can move forward with our eyes open and the lights on and our 3-lane highway without any barriers right in front of us. But what does this really mean for us as we conclude for the future? It means that, and this is my favorite slide, and it's the physical manifestation of it is right behind me. It's one of my most prized possessions, is that this is how we move upstream in Indiana. The health atlas, health and well-being atlas that I talked to you about that we built here is unmet social needs. It's what you're missing in your life today. I don't have enough food. I don't have transportation. I'm worried about being able to pay for or find quality childcare. I can't afford healthcare. I'm worried about my job. Those are unmet needs. Those are problems that we can solve, but they're a problem that we should build a healthy infrastructure so that they never happen in the first place. And that really is the crux of Data Matters, Stories Convince. Let's meet and build the infrastructure to meet those unmet needs, to talk about social drivers of health and understand them today, so that tomorrow we build a healthy community where we've anticipated those problems and solved them before they even happened. That happens with our plan. Understand, educate, that leads to empathy, refer, build a network, and prevent. Prevention in the upstream is exactly where the future of data is going. It helps us, again, understand, react, and do rapid cycle interventions so that we improve in a way that we've never really conceptualized before. We improve health, and by improving health, we improve the human condition because we think about health in its big picture. It means housing, safety, transportation, food, childcare, livable wages, and all of that comes back to the integration and the understanding through data. It's been an absolute pleasure to talk with you this morning, and I look forward to taking your questions, and I bet there'll be some doozies. Thank you so much for having me today. It's been an absolute pleasure.